Thank you, Mr. Speaker. My question is for the Minister of Finance. Minister, on page 288 of the budget, it clearly shows the Canada Health transfer has increased by $652 million this year. That is money the federal government has specifically earmarked for health care in Ontario. On page 289 of the budget, it shows the Ontario health budget only increased by $598 million. That means there is $54 million missing. That means you took $54 million from the health care budget to pay for your fiscal mismanagement. It's exactly what the auditor said recently is going to start happening because of your high debts and deficits. You're crowding out important programs, in this case, health care. So, Minister, what did you do with the $54 million the federal government gave you specifically for health care?
Thank you. Minister of Finance.
Minister of Health, Mr. Speaker.
Minister of Health and Long-Term Care.
Thank you, Mr. Speaker. And I think, the member opposite, being a former health minister, probably knows that the Canada Health transfer only represents about a quarter of the health expenditures in this province. Roughly $13 billion out of $50 billion dedicated to provincial health care this fiscal year. And so the federal government, for example, in 14-15, the federal government transferred $473 million, but health spending went up by $1.2 billion, Mr. Speaker. So the federal transfer doesn't even come close to filling that hole. And the imbalance that will even increase in the coming years in 2017, 2018, and
Order. That round was the freebie. Carry on.
So that sharing between federal and province that used to be 50-50 is down to 25% from the federal government. That imbalance that we're seeing, which is going to get worse in 17-18, will remove $21 billion from health care transfers nationally and $8 billion in Ontario alone.
Thank you. Supplementary.
Back to the Minister of Finance. You can spin this all you want, but they gave you $652 million, and your total budget only went up by $598 million. Somehow somebody along the way stole $54 million out of health care. This is the equivalent.
That's too edgy. I'm going to ask the member to withdraw.
Withdraw. $54 million, Mr. Speaker, is the equivalent of 9,000 long-term care beds. A constituent of mine is desperately waiting for a long-term care bed. However, none are available. Because of the long waiting list, this resident is in a retirement home. True story. That home is costing his family over $7,000 a month to cover the cost of the care he needs. That is care he could be receiving.
The member from Kitchener-Conestoga, the member from Prince Edward Hastings, come to order.
Something else. So I say to the minister again, why did you cut share of health care funding when we need more long-term care beds, for example?
Thank you. Minister.
Well, thank you, Mr. Speaker. As I mentioned, that 50-50 sharing that used to exist between ourselves and the feds is now down to a 25% contribution, which is going down even substantially. That $21 billion nationally hole that is about to face us. And I would suggest to the member opposite that individual in his riding could get the support that they need if he had actually started advocating for Ontario instead of the federal Conservative government, instead of Ontario get its share, because the federal government has abdicated its responsibility to actually provide support to the province based on the changing demographics. In fact, the parliamentary budget officer, the federal parliamentary budget officer, has suggested that the federal government has pretty well insulated itself from the fiscal impact of an aging population. We can't and we won't do that in this province. I would hope that the PC party would advocate on behalf of Ontarians instead of the federal PC party.
Be seated, please. Be seated, please.
Minister of Transportation, second time. Final supplementary.
I say to the Minister, Mr. Speaker, in my first month as Health Minister in 1995, Paul Martin had the health transfer down to 13%. You're getting 25% from the federal government. It's $54 million that's gone missing. They gave you that money. What did you do with the money? It's a pretty simple question. That could have bought That could have paid for the 20 new hospices that you promised in last year's budget and done nothing about, including Matthews House Hospice in Alliston. You could use it to build new nursing home builds. You haven't built one new nursing home bed or long-term care bed in 12 years. Instead, you took that federal money, that precious money that's given to you, $54 million, and floated it away on your fiscal mismanagement. I'll ask you again, Minister, where did the $54 million of health care money go that the federal government gave to you?
Thank you.
Well, thank you, Mr. Speaker. And as I mentioned, this last fiscal year alone, health care spending in this province went up by $1.2 billion. The federal contribution to that was less than the 50% that it used to be. It was $473 million, which left a large gap, a gap which is only going to increase over time as the federal government continues to abdicate their responsibility to address the changing demographics in this province and across the country. I implore the member opposite, the interim leader of the Progressive Conservative Party of Ontario, to advocate on behalf of Ontarians and not defend the federal government, to stand up for Ontarians, stand up for health care in this province, and don't back up the federal government as they continue to withdraw for providing that important service.
Be seated, please.